Welcome to Business Authority Radio, bringing you insights from today's thought leaders, professionals, and influencers. With your hosts, Neil Howe and Craig Williams.
Hello and welcome to the show. This is your host, Neil Howe, and today my special guest is Bob Schroedter. He helps people who are injured and require rehabilitation, or those who are looking for an edge in their athletic performance. He is fellowship trained in orthopedic manual physical therapy. He is board certified orthopedic clinical specialist. He is a doctor of physical therapy, a longtime educator in Pilates rehabilitation. He's certified gyrotonic instructor. We'll have to find out what that is. Certified in dry needling. He's an adjunct faculty with the University of Miami and has a cash pay private practice for over 7 years. Wow, welcome to the show, Bob.
Thank you, Neil. Pleasure to be here.
Well, this is National Physical Therapy Month, and we are highlighting physical therapists. So tell me exactly what a physical therapist is.
A physical therapist is a healthcare professional who trains and rehabilitates individuals either pre-surgically or post-surgically, pre-injury or post-injury, and serves as an advocate for the movement system of the human body. So we tend to look at ourselves as movement system experts, rather than, which is in contrast to maybe thinking about pathology and how the medical model of healthcare works here in the US. We deal with impairments and movement dysfunctions primarily. So our job is to get you moving better, move smarter, not harder.
So it's all about movement and being able to move freely, using that full range of motion, and of course without pain, which seems to be a major problem in American society. So tell me more about the types of people that you help. Who is your typical client?
A typical client for me is anybody who is willing to be part of their rehabilitation and really needs a closer look at something that they've been struggling with in terms of lack of function, not being able to perform well at their job or their recreational activities due to some kind of a bodily complaint. So usually the types of people that I tend to see in a cash practice are a little bit more self-motivated than others. So they like to be participants in their own plan of care, and they appreciate the individualized service.
That's definitely good that people want to, help themselves get better. That's really the first step. But tell me more about the types of people that you serve. You said people that are having problems maybe at their work. So is it people that do physical labor? Are they the ones that really come in and see you?
It can run the gamut of people who have physical jobs. I think, even desk workers, desk jockeys have physical jobs. They just are more sedentary in that physicality, but there's a lot of postural endurance that they ask of their body that their body just can't deliver on, versus other athletes that I'll see who have a more active lifestyle, whether they're professional athletes or recreational athletes, or people who want to become an athlete as well. I see a whole bunch of different types of folks along a spectrum of abilities.
So what major problems do they have? Obviously you're the movement expert. How are you helping them solve the problems that they have?
Well, a lot of times the problems may originate or may come their attention as complaints or issues within their body. But part of my job, and it's the most challenging aspect of my job, is to really direct their attention at all the factors that contribute to, lead up to, and have a consequence on their primary complaints. So they may be unaware of the fact that they've been compensating for that pain in their foot by lifting their hip in a different way, and so now they're coming to me with low back pain and with foot pain, and they think they're unrelated. So it's my job to try and find the common link in some things, if there is a link to be found, and address the body holistically. So my forte is not to just look at where the complaint is, but to take into account the rest of the segments of the body and how they work together.
So the primary complaint is not usually the primary cause of the pain, is that right?
It can be. I mean, it can run both ways, but I think because we are three-dimensional organic beings, that we everything is interlinked and interconnected. So we may have a primary problem, let's say with this heel pain, that is attributable to local tissues being inflamed, and issues around the foot and ankle having to be addressed. But at the same time, because we're also on our feet and we're upright for most of our lives, we have to also take into account the other segments as well.
So describe to me what the process is. If somebody's coming into you with pain, how do you start?
First session is an initial evaluation. And so that allows us to spend some time getting to know one another and develop what's called a therapeutic alliance, which is one of the most, if not the most important aspects of a person's rehabilitation. The ability to have a trusting, committed, and loyal rapport with your healthcare practitioners, such that, not just whatever they say goes, but you realize that you're in a partnership within your own rehabilitation. So that rapport building, that therapeutic alliance is established or begins on the initial evaluation, the subjective history taking, listening to the patient's story, not just about what they're saying, but also trying to read body language, read between the lines, ask probing questions, things about them that they may not thought were related, but may actually have some kind of relationship to their primary complaint. So a thorough subjective history, and a lot of times will give you the answer to what's going on 70-75% of the time. Followed by that is a physical exam, which includes a movement screening. And the movement screening guides the person through a range of general movement patterns that allow them to express authentic movement, and allows me to see how they're moving in a manner that either is compensated or not. And then I get a little bit more specific based on what I see going on. So that movement screening will turn into a more directed tissue level assessment of where their impairments are. So impairments being limitations in bodily movements. So if you can't bend your knee on your right side as much as on your left, that represents an impairment. And so that may translate into a functional dysfunction or functional disability of not being able to get up and down from a chair. So the physical exam really brings to light some of the more objective measures of what the subjective exam clues you in on. So they go back and forth, and then there's a test and retest process. So treatment is really started pretty quickly with me, because I don't want to wait too long to find out if what I can do for this person is actually moving in the right direction or not.
It sounds like you spend a lot of time with them on the first evaluation. That's a lot different than maybe going to a doctor who is going to spend about 2 minutes with you and prescribe some kind of medicine. What does that do mentally to the psyche of somebody that comes to you and spends that kind of time with you, telling all their background and their history? What does that do for the rehabilitation?
Well, hopefully it really propels it forward, even without any sort of hands-on treatment yet. Just establishing that kind of relationship ahead of time really sets the person up psychologically to want to participate and to really look at treatment as not something to endure, or something to fear, but actually something to look forward to because it's going to help them. And we know from the literature that fear is one of the top barriers and obstacles to a person getting better. They've gotten fearful of movement because it hurts, understandably. They've gotten fearful of participating in life because it hasn't rewarded them when they've tried to do that. And so another big challenge that a physical therapist typically faces is getting, into some of the psychology and mind-body connections of a person's state of health.
Definitely. That's something that I truly believe in as well, is the state of mind is really going to help you get wherever you want to go. But let's talk more about the physical things that you were able to do for them. What does treatment actually look like?
So I have a host of different approaches and tools in the toolbox that I can employ. On the manual therapy end, it can run from soft tissue work to joint tissue work, which includes manipulation. It can go into dry needling. I can use instruments to assist me with the soft tissue work. That's the manual therapy end of things. The exercise component involves retraining movement. So the observation in the beginning with the physical exam really starts to evolve the hypothesis of what might be going on, and then the movement retraining helps to re-establish a sense of normalcy to the nervous system once the manual therapy has done its job of improving movement quality and establishing a base of safety. So in both the exercise prescription that I give as well as the manual therapy that I deliver, I'm trying to influence the nervous system at a very primal level to understand that safety messages are being sent more than danger messages. So it gets very hands-on, and it gets very active as well. There's really not a whole lot of passivity to my treatments. So I think that's where people will really appreciate a difference.
You got to keep them moving.
Yep.
Now, you mentioned a couple of things, or I mentioned a couple of things in your introduction, dry needling and gyrotonic. Explain to us what those are.
So dry needling is the insertion of a monofilament into a trigger point or into myofascial tissue, looking to change the tonicity in the surrounding musculature. So trigger point is a local band of taut and hyperirritable tissue that has too much accumulated tension around it, and therefore has changed the biochemistry of the surrounding muscle. So the muscle is actually not able to function normally, and when one muscle doesn't do its job, it has to the body has to continue to move, so it's going to recruit other less able muscles to supplant that function. And the dry needling seeks to reset in a lot of ways, like the Control-Alt-Delete of a computer might reset or reboot the system. And it does it on a local fashion. The tissues tend to release tension and there's better circulation, but it also does it on a non-local or remote sense, because the brain is always part of the equation and always monitoring what's going on. So it's changing how it actually represents the body part that's being addressed. So
Is that something similar to acupuncture?
So the similarity with acupuncture is only in the tool. So the monofilament that an acupuncturist uses may be similar to, but can also be different from the monofilament used in a dry needling situation. The difference with acupuncture is, first of all, acupuncture, and this is a good thing for people to keep in mind, acupuncture is not defined by a modality. So insertion of a needle into the body is not acupuncture. It's a modality used within the profession of acupuncture. Now, dry needling is a modality used within the profession of physical therapy, for example. And so acupuncture, which operates along a traditional Chinese medicine paradigm, looks to release barriers to energy flow through meridian points, and dry needlers have a different intentionality and philosophy of treatment.
And you're also a gyrotonic instructor. What does that?
So gyrotonic is an exercise system with its own set of movement principles and proprietary equipment and training that looks to expand joint spaces within the body using spiraling movements and helping the person learn how to efficiently coordinate the spine with the extremities. It was developed by a Hungarian former yogi, former dancer in the 70s, who's actually still with us and still creating and still evolving the technique. But it's the lesser known cousin to Pilates, let's put it that way. Although it's different from Pilates, it attracts a lot of the same focus of mind-body awareness, breath integration, and movement quality through efficiency.
So what are a couple of the misconceptions that people might have about physical therapy?
Well, physical therapy over the years has been poorly branded by the profession itself, and so it's done its own self a disservice by not educating the public as to the breadth of competencies that are within it. So people have gotten used to thinking that, I'm going to go get physical therapy. That must mean hot pack, ultrasound, and massage. And colloquially in the profession, we call that HUM treatment, HUM. And that has been, the biggest sticking point for, more advanced and modern practitioners of physical therapy, because we're trying to always get away from that stigma and try to present to the public this understanding that, there's clinical reasoning behind what we're doing. There's high level, clinical decision making and high level hands-on treatment that's going on. We're not just relying on modalities to get you better. And so, I think a misconception that people might have is that it's more of a passive, ineffective approach or adjunct to their care. That's one of the things.
So what fears might people have about going to see a physical therapist?
Well, unfortunately, PT has been replaced in some people's minds by the phrase "physical terrorist," and so they've heard stories or they've had experiences with some previous physical therapists where no pain, no gain was kind of the mantra, and you need to get something moving. We're just going to push it and push and push it, and I'm sorry if it hurts, but this is the best thing for you. So we're now in a different era of understanding how the body works and how the nervous system really plays an important role in all this. And the literature is quite clear that if you push a person into pain, you're going to get an unwanted response from the rest of the body. You may actually put them into more of a harmful situation by disregarding some of their pain, but at the same time, you have to learn to educate your patients ahead of time about pain, because people come in again with misconceptions about, why their body hurts and what the actual pain generator is in their body. So it's an important new step, I think, within the last 25 years that physical therapists are embracing this role of being pain education, pain neuroscience education advocates.
So, what other than the pain, the fear of the pain, might stop somebody from taking action to go see a physical therapist?
Well, if they've had a relationship, let's say, with other alternative practitioners that, where the other alternative practitioner doesn't understand themselves what physical therapy offers, or even if they've trusted their general practitioner, their physician, but the physician themselves hasn't really embraced a good understanding of what physical therapy can offer, and they have a loyalty to those other providers, then they're probably less apt to want to engage with a physical therapist, no matter how much promotion we put out there. So, in a cash pay practice like I operate, which is primarily word of mouth, my job is to, when I treat a patient, is to educate the patient and let them be the best advocate and promoter for me going forward, so that people can have more than one opinion of what physical therapy can offer, rather than just relying on something that they heard from someone else that may not have a direct experience.
There seems to be a lot of miseducation about the physical therapy industry, but you physical therapists out there are there to help people relieve their pain in the best way possible, and you're probably the most qualified in order to do that. So let's talk about somebody that you have been able to help in your practice in the last 7 years. Maybe somebody springs to mind that came to you with a major problem. They were in pain, or they've had an injury.
Right.
What was the circumstance there? How were you able to help them, and how did it, completely change their life? What outcome did they achieve?
Well, it's a very interesting and timely question, because I just came back from a conference where I presented on a case study of a rather unique individual who was dealing with chronic pain for about 4 years after a car accident. And this patient had a constellation of issues that included issues around his face and jaw, issues around his neck, and also a strange inner ear condition that wasn't diagnosed, couldn't be sussed out by his other providers. And so he came to physical therapy for treatment, and we were able to work with him with, doing some soft tissue work, doing some joint tissue work, doing some dry needling, a lot of pain neuroscience reeducation, because he was, in a chronic pain state for 4 years. So he had already adapted his understanding of what he could maximally achieve to be X. And so we had to make sure that we were careful with the words that we chose and the concepts that we were challenging in him, so that he understood at a very basic level that, this wasn't his lot in life. This was something that could be changed if he wanted it to be changed. So, in addition to the hands-on treatment and all the education, we worked with him to reestablish a certain sense of control over the chronic pain that he had identified with for so long. And so in 4 treatments, we had significant change in his pain levels, in his jaw function, in his functional disability scores. And by the 12th visit, he was almost back to normal. So, and he was a manual laborer. He worked in carpentry, so it wasn't that he could just sit around all day. He had a family, he had a business, he had a profession, an occupation that he loved, and it was really put on hold for 4 years.
Outstanding. I mean, I love these stories that just get people back on track, and it's amazing how that mental part had to be fixed first before the physical application as well.
Right.
Well, Bob Schroedter, thank you very much for being my guest on Business Authority Radio. I got a couple more questions before I let you go. What got you into this physical therapy industry in the first place? What was your passion about helping people?
That's also interesting that you asked that. Well, I started out actually in engineering. I have a graduate level degree in structural engineering, and my passion for engineering started to wane when I didn't feel that I was fulfilling my true capacity and potential. And so I took a few years off from that track and kind of explored different things. And when I started doing some internships looking into physical therapy, I really found the best fit for what I wanted to do to impact society and to serve with everything that I had: my head, my heart, my hands. And that passion, that drive, that initiation has always been with me. And I've been, in practice now for over 15 years. And I'm more enthusiastic about my profession and what can be accomplished now more than ever.
Well, I'm sure all your clients are enthusiastic about that as well, and glad that you made that change and followed your passion. Now you're down in the Miami area. How do people get in touch with you and your business?
So my website is probably the easiest way to kind of get to all forms of communication with me. And that website is www.movethroughrehab.com. That's MOVETHRUREHAB.com. And that will send links to my Facebook page that should have my contact information is there as well. So everything's available.
Excellent. Well, Bob Schroedter, thank you very much for being a guest on Business Authority Radio. I really appreciate all the education that you have given us, and we appreciate everybody that you help move pain-free if you're down in the Miami area. And encourage you to go check Bob out, movethroughrehab.com. Well, that's it for today's show. If you've been listening to Business Authority Radio, if you like what you hear, hit that like button and share, and we'll see you next time on the show.
You've been listening to Business Authority Radio with Neil Howe and Greg Williams. To learn more about the resources mentioned in today's show or to listen to past episodes, visit businessauthorityradio.com.